Hello everyone, this is a D Pharmacy Pharmaceutics 1 class, subject code 1.1T, Unit 5. Today we are going to discuss the official tests for evaluating tablets. There are four official tests for tablet evaluation. Among them, the first one is weight variation test. In this test, we have to take 20 tablets and we have to weigh them individually. We have to calculate the average weight, and the average weight should be compared with the individual weight of tablet. The tablet passed the United States Pharmacopoeia test if not more than 2 tablets are outside the percentage limit and no tablet differs by more than 2 times the percentage limit. The next one is drug content. Randomly, 30 tablets are selected, among which 10 tablets are again collected for individual assay. The batch of the tablet passes if 9 out of 10 tablets contains not less than 85% and not more than 115% of the label claimed amount of drug. If a single tablet or the 10th tablet not contain 75% to 125% of drug of the label content, then the remaining 20 tablets are to be assayed individually, and among these 20 tablets, no tablet should fall outside the limit of 85 to 115% of range. Then disintegration test for tablet. Disintegration time can be known as the time required to break down the tablet after swallowing. The rate of disintegration depends on the type of the tablet. The tablet which are dissolved by slow solution in mouth or chewed or are to be dissolved in water before administration do not need a disintegration test. Generally, disintegration time can vary from a few minutes to as long as 30 minutes for a conventional tablet. In case of enteric coated tablet and sustained release tablet, the disintegration time is longer than usual. The diagram showing over here is the diagram of a disintegration test apparatus. Here, two baskets are present or two beakers are present where this is an assembly and it contains 6 cylindrical glass tubes. The tubes are around 3 inches long and they are open at top, and at the bottom portion one mesh is present. The temperature of this is maintained around 37 degrees centigrade, and the medium we are keeping over here is generally different buffer solution that can be simulated gastric fluid. Generally, it is been simulated gastric fluid, and then the medium can change depending on the experiment. It can also be simulated intestinal fluid or phosphate buffer having pH 6.8. Each tablet, a single tablet is placed on each tube and a up and down movement is observed, and the rate of this movement is generally 28 to 32 times per minute. The temperature maintained inside is around 37 degrees centigrade. This is a common test protocol, but the protocol changes depending on different types of tablet. Now we will discuss what is the method used for uncoated tablets. One tablet in each 6 tubes were placed, and a the temperature was maintained around 37 plus minus 2 degrees centigrade. After 15 minutes of movement, there should not be any tablet that has not gone for complete disintegration. In case one or two tablets fail to disintegrate completely, then we have to repeat the test by taking an additional 12 tablets. The tablet passed the test if not less than 16 of the total of 18 tablets tested have disintegrated. Then, in case of coated tablets, we have to place one tablet each in the basket, and the tablet if the tablet has a soluble external coating, we have to immerse the basket in water at room temperature for 5 minutes. Then we have to operate the apparatus for 60 minutes, and the tablet should pass the test if all 6 tablets have disintegrated. In case any of the tablet fails to disintegrate, we have to repeat the test by taking another 6 tablet, replacing the water with 0.1 normal HCl solution. The tablet then pass the test if all the 6 tablets have disintegrated in the acidic medium. The test is repeated by taking 12 additional tablets if one or two tablets still fail to disintegrate. The sample passes the test if not less than 16 of the 18 tablets tested are disintegrated. The third one is in case of enteric coated tablets. We have to place one tablet each in the basket, and then we have to immerse the basket in water for 5 minutes at room temperature if the tablet contains a soluble external coating, and we have to operate the apparatus for 2 hours after immersing it into 0.1 normal HCl solution maintained at 37 plus minus 2 degrees centigrade. If no tablet shows sign of disintegration or any cracks, we have to add a disc to each tube and operate the apparatus using a mixed phosphate buffer having pH 6.8 by maintaining the same temperature. After 60 minutes, we have to remove the assembly from the liquid and observe the tablet. The tablet passed the test if all the 6 tablets are disintegrated. The test should be repeated if some tablets fails to disintegrate, and 12 additional tablets should be taken for repetition of the test. The tablets pass the test if not less than 16 out of 18 tablets are disintegrated. The next one is dissolution testing. Dissolution testing, generally we use two different types of dissolution testing apparatus. Mainly, one is paddle type, another one is basket type. In the diagram over here, a paddle type dissolution apparatus is shown. USB type 2 is a paddle type apparatus and USB type 1 is a basket type apparatus. It is having a capacity of 1000 ml and it is fitted with an motor. The motor can run from 25 to 150 rpm. The temperature maintained inside is around 37 plus minus zero point 0.5 degree centigrade. The general method for conducting dissolution is you have to place 1000 ml of water which should be free from dissolved air, and it has to be, the temperature of the water has to be around 37 degrees centigrade inside the vessel. The tablets are to be given inside the basket. After setting the temperature, we have to start the motor and the rotational speed should be according to the need. It can be around 50 rpm or 100 rpm. We have to withdraw the stated volume of solution from the vessel after certain period of time specified in their tablet monograph, and we have to go for analysis of the sample. The tablet passed the test if for each of the 5 tablets the amount of active ingredient in solution is not less than 70% of the stated amount. Generally, the experiment is repeated for 4 times and no retesting is allowed over here. So that is all about dissolution testing. In case of dissolution also, we can use different buffer solution depending on the type of the tablets or the type of the drug we are using and their solubility. So these are the official tests for tablets. Thank you.